Hi guys, my name's Amanda LaGuardia, and I'm going to be discussing to you guys about my recreational therapy facilitation technique. And in my case, it's therapeutic massage. This form of therapy, according to rejuvenation massage therapy, is a general term that describes any type of massage modality that helps relieve pain, reduce stress, and work on a specific problem, such as frozen shoulders. So, as an excellent therapist, they will apply the specific technique and the right amount of pressure to address the client's needs, which can include deep or light tissue massage. So people have this misconception that let's say you have a knot on your back, to apply deep pressure on it or to massage it very roughly, which actually has been proven the opposite. It can actually hinder the muscle and make it actually worse. As a therapist, you're going to communicate with your client and figure out what works best for them, whether to apply more pressure in the area, or if you're doing it too hard, to apply a lighter touch on the area. So you're just basically going to communicate with them to see what works best. And you, as a therapist, you're obviously going to know the body a little bit better, so you're going to know what areas of your back or whatever part you're massaging needs more deep tissue massage or a lighter touch. And this form of therapy is just basically known to repair scar tissue and use release techniques to open up damaged areas. It's also known for flexibility, which is conducted to open up connective tissues to relieve pressure that can be causing pain in your joints. So now I'm going to be discussing to you guys the description, the purpose, and the history of therapeutic massage. And we're going to go ahead and start with the history of therapeutic massage. And the history of therapeutic massage dates back thousands of years to ancient cultures that believed such highly in its medical benefits. The first written records of massage therapy are found in China and Egypt as early as the 2700s of BCE. And according to an online resource, which is All Allied Health Schools, we're basically going to be discussing more of the Western side of how they discovered therapeutic massage. And in the early 1800s, it was from an early massage therapy history that the Swedish doctor, gymnastic, and educator Per Henry Ling developed a method of movement known as the Swedish movement system. This is regarded as the foundation for the Swedish massage most commonly used in the West today. Along with the Swedish movement system was developed by Ling, it was Dutchman Johan Georg Malsker who defined the basic hand stroke of Swedish massage. Today, the most common types of massage practiced in the Western Hemisphere are the Swedish massage and the Japanese massage practice of shiatsu. So we're basically going to be discussing more about the Swedish method. The proper description of massage therapy is manual manipulation of soft tissues such as muscles, connective tissues, tendons, ligaments to enhance a person's health and well-being. There are a dozen types of massage therapy techniques such as Swedish massage, as previously mentioned, sports and clinical massage, as well as deep tissue massage. So I would summarize everything because the main purpose of therapeutic massage is that for the clients, their main purpose is for them to relax, reduce their stress levels, as well as lower their blood pressure. Not to mention, this form of therapy promotes health, muscle relaxation. So people have this misconception of where therapeutic massage is going in the near future. And on that online resource, I picked up a little paragraph that I'm going to go ahead and read to you guys. And so considering the long history of massage, its incorporation in Western medicine is only in its infancy. The potential for growth and research for the healing properties of therapeutic massage and body work has gained great monument over the last 50 years, and the public demand for massage therapy is at an all-time high. So some of the practices that therapeutic massage is used in spas, gyms, workplaces all around the country. Using massage therapy to promote balance and maintain internal and external health is something that is now a standard part of the North American lifestyle. In the health care industry, massage is commonly used in hospitals, nursing homes, and in birthing centers. It is also used in physical therapy and in chiropractic clinics to treat pain, increase circulations, and expedite the healing of injured muscles. So now I'm going to go ahead and be discussing to you guys the theoretical foundations of therapeutic massage. So the theoretical foundations of therapeutic massage include gate theory of pain relief, hormonal influence on pain perception, muscle relaxation, stress reduction, and interpretation of negative chronic posture. So for gate theory of pain relief, it is one of the most popular reasons for providing therapeutic massage is for pain relief, and in this theory it explains how massage influences pain perception. So the hormonal influence on pain perception, such as their hormone levels, especially endorphins, also influence perception of pain. Neurotransmitters, chemical messengers in the central nervous system, control production and release of pain relieving hormones such as endorphins. So for muscle relaxation, while the gate theory and hormonal influence on pain perception may account for immediate and short-term pain alleviation, muscle relaxation can produce longer-lasting pain-relieving effects. And stress reduction, whether emotional, mental, or physical stress affects the autonomic nervous system, which controls all involuntary activities of the body, such as digestion, heart rate, and hormone levels. Interpretation of negative chronic posture. Expanding on the idea that stress induces muscle tension, people often develop physical and emotional defenses. In response to stress, these defenses are created through chronic stress, condition muscles to remain tense even after the stressor is no longer present. So that's a very important aspect to understand. So this form of therapy can benefit the population of individuals anywhere from young adults to the geriatrics population, anyone basically suffering from pain in the body, suffering from anxiety or disability symptoms. So I'm going to go ahead and start with pain. Individuals with a variety of illnesses, disabilities, and disorders experience chronic pain. The pain can be in the lower back, in the neck, in the shoulders, can be pain associated with arthritis, or pain due to illnesses or disabilities. There was a study that was done in 2014 on 59 adults ages 53 to 60 years of age by administering a controlled randomized single-blinded trial study to compare effects of a 2-week 30-minute session of chronic lower back pain. Therapeutic massage was done on the patient with deep tissue massage. This study was compared to supplemented non-steroid anti-inflammatory drugs that can have the same effects of this therapy. So they were able to prove that these non-steroid anti-inflammatory drugs were having the same benefits of therapeutic massage. So if you had an option to do therapeutic massage which doesn't require any intake of chemicals into the body, wouldn't you prefer that? This study showed deep tissue massage had a significant positive effect on reducing pain with adults with chronic back pain, and the concurrent use of non-steroid anti-inflammatory drugs contributed to lower back pain to a similar degree as massage therapy alone. There was also something done on anxiety. Anxiety, which is something that happens basically to a lot of us. It could be related to school. When you have a lot of workload on you, you tend to develop anxiety, and therapeutic massage tends to help in that. Therapeutic massage has also been proven to help individuals suffering from anxiety. Research examining effects of massage on anxiety has been proven to increase in functioning and reduction in long-term pain and associated discomforts such as distress. There was a study done in 1983 that investigated effects of 10 sessions of connective tissue. They were each 30 to 45-minute sessions on relaxation and muscle tension among 5 adults, 3 men, ages 26 to 56. Results indicated greater relaxation and reduced muscle tension among participants. 4 participants experienced a reduction in heart rate, 2 showed significant increases in skin resistance, and 2 showed significant decrease in EMG readings. So now going to the disability symptoms, there are many individuals with a variety of disabilities such as respiratory dysfunctions, attention challenges, immune system disorders, cancer and related treatments, who potentially could benefit from therapeutic massage. Results did show that decreased muscle tension and anxiety associated with massage appear to have positive effects of a number of health conditions. So there was a study that was also done on disability symptoms on people with life-limiting illnesses such as advanced cancer, typically encountered chronic pain, fatigue, anxiety, and decreased quality of life as a result of the illness and associated treatment. So a study was conducted in 2014 that examined effects of 20 to 30 minute massage therapy sessions consisting of long, slow gliding strokes with limited trigger points, typically used light to moderate pressure depending on health, on 153 individuals receiving specialized medical care by VA Healthcare. There were statistically significant improvement on symptoms in the short term associated with pain, anxiety, perceived relaxation, and inner peace, as measured by survey adapted from the well-being scale and retrospective chart, reviews containing data from standard measures of pain, mood, anxiety, depression, and cognition. So now I'm going to go ahead and be discussing to you guys pain associated with arthritis, and this is basically referring to the geriatrics population. Sometimes you have arthritis because you have stiffness of the joints, and it's actually been proven that therapeutic massage can actually loosen those tendons and cause less pain. Arthritis is characterized by inflammation in one or more joints, with the main symptom being joint pain and stiffness that typically worsens with age. Coincidentally, massage is often used to help reduce the pain. There was a study done that was conducted in 2013 by Field and colleagues, implemented a randomized group design with repeated measures to examine effects of 4 weeks, which is basically once a week by therapists and once a day by self-massages by their own client. Moderate pressure massage theory compared to a light pressure massage therapy on 42 adults, 27 women, and a mean average of those women were 51, with rheumatoid arthritis in the upper limbs. When compared to light pressure massage, participants receiving moderate pressure massage reported less pain as massaged by the visual analog scale, higher perceived grip strength, and greater range of motion in their wrists, elbows, and shoulders. There was actually a study done in 2013 by Field and colleagues that implemented a randomized group design with repeated measures to examine effects of 4 weeks, which is once a week by a therapist and once a day by the client, of self-massaging, moderate pressure massage therapy compared to a light pressure massage therapy on 42 adults, 27 of them were women, and their mean average of their age was 51, with rheumatoid arthritis in their upper limbs. When compared to light pressure massage, participants receiving moderate pressure massage reported less pain as measured by the visual analog scale, higher perceived grip strength, and greater range of motion in their wrists, elbows, and shoulders. So there you have it. It's just a basic summary of the benefits of therapeutic massage and the benefits that it can have on the body, how important it is. And if you're suffering from anywhere from depression, anxiety, stiffness of the joints, therapeutic massage can benefit anyone basically, in young adults to the geriatrics population. It can be from athletes and anyone from that. Hi guys, so I'm going to be demonstrating you therapeutic massage. There are about 6 different Swedish massages that you can use, techniques that you can use. The 2 that I'm going to be demonstrating to you today are friction and microfil release. And basically what friction does, it releases muscles and trigger points, and what you're basically going to be do is move past the skin and go to the muscle and you're going to apply pressure to the area. So my example is going to be, let's say a young adult that is, let's say hypothetically, an athlete and he has knots on his back. So what we're going to do is apply deep pressure to kind of release the muscles. So kind of go opposite way like that. You can use your hands to apply muscle. And the other one is a microfill release, which is a moderate traction and twisting of the fascia. It creates greater blood flow and greater rotation of movement. So basically, you're just kind of gonna go like this. Kind of just stretching the connective tissues. And adaptations would be anywhere from knots that he has in certain areas. You would adapt by applying deeper pressure sometimes there. If I'm doing it too hard, I would have to do a lighter touch to the skin, and just go from there. Every patient that you have or every client that you have is going to be different. So you're just going to have to communicate with them and find out what is the best technique for each client or patient. And you're just going to go softly, deep tissue massage. You can do light tissue massage. Just going to go ahead, communicate with your client and make sure that everything feels good, that you're not doing it too hard. Maybe you're doing it too lightly, they want you to do it harder, and you're just going to go from there.